Hi, Dr. Ahmed with the Brain and Spine Institute of San Antonio. In this video, we are going to talk about an anterior cervical discectomy and fusion, otherwise known as an ACDF. Please keep in mind that these videos are specific to the patients being treated at this medical practice, and that these videos provide a generalization of what the surgery will be like. An ACDF starts off with a small incision in the front of the neck, typically done on the right side. The incision is about 2 centimeters. After that, dissection is made through the neck to get down into the spine. There are several key structures that one has to watch out for, including the trachea and esophagus. Right here in the middle, you have numerous blood vessels and nerves, and then ultimately, once everything is dissected, you get down into the spine. Once we're down to the spine, we're going to start by removing the disc that is causing the problem. With the use of our instruments, we're going to clean up that disc, remove any bony spurs or arthritis that is all contributing to the symptoms. Now, once that disc has been removed, there is an empty space in between the vertebrae and a spacer is placed in between the bones. This spacer is then secured with screws that are built into the spacer, or it's covered with a little plate and screw system. Now, depending on how many levels are being addressed, the surgery can last anywhere from 45 minutes up to 2 hours. A majority of these surgeries are done as an outpatient, which means you go home the same day. You are going to get a collar that you're going to wear after surgery. That collar is to be worn when you are up and about walking around. If your surgery is done as an outpatient, it is common that you will leave the hospital with a drain coming out of your incision. We ask our patients to come back to the office to get that drain removed. Your first official post-op visit is usually at the 2-week mark. At that time, we check your incision and then we start physical therapy. The purpose of physical therapy is to regain strength in your neck, regain range of motion and flexibility so that you can get back to normal. Patients are usually cleared to go back to work anywhere from 2 to 4 weeks after surgery, and that includes driving as well. As you recover from surgery, you have lifting restrictions that are ultimately elevated, and by the end of month 3, they're fully removed. At the Brain and Spine Institute of San Antonio, our complication rate is less than 1%. I hope that this video provides a nice summary of what an ACDF is.